Hello, Dr. Garcia. It is wonderful to have you here today. You have been a mentor for me. We work together. You used to visit my office.
You used to be my boss.
Well, I used to be boss, um, supervisor, if you
Okay.
will. You even looked at my daughter's ears. I forgot about that when Madeline she had to have the ear tubes.
Right.
Yeah.
Right.
Yeah, so many connections. And he's a wonderful person, a brilliant audiologist, and really a fantastic faculty member, leader. The students always talk good things about you. You are also the only male in your unit, so you have that going for you.
Which means, in fact, I'm the chair of the communication sciences and disorders. And so most of the time, my faculty never agrees with me, but that's okay.
You can still have the final vote.
That's true. That's true.
Awesome. So, why don't you tell us a little bit about yourself, Bob? Why you're interested in interprofessional practice? I might show some images on my screen and we'll just see where it goes.
Okay. Sounds good. So I have been a practicing audiologist, a clinical audiologist for over 30 years. And I've worked in a major medical center. I've worked in ear, nose, and throat physicians' offices. And then I've worked at a couple of different university clinics. And with the exception of when I worked at the medical center, in all other situations, it's always been me seeing patients as a professional or seeing clients as a professional, but it's always done just with me. And what the reason I'm telling you that is because as a financial planner, you have so much to offer these families that I deal with on a daily basis. One of the shortcomings, I think, of our healthcare system right now is that I may see a client and tell them what I'm thinking, and then they may go see the physician, and then they see the speech pathologist, and then they may see a nutritionist, depending on what's going on. But none of us really work together. We're making all of our assessments and recommendations independently. I was fortunate enough early in my career when I worked at University of Nebraska Medical Center that I was on something called the craniofacial anomalies team. And you could actually think about that as being interprofessional practice, which I'll talk a little bit more in a minute. But we basically had these kids come from all over the Midwest that had craniofacial anomalies. There were probably 10 different professions. We all evaluated the child the same day, met with the family the same day, and then all of us met together and came up with a comprehensive plan to share with the parents to help the child. You can imagine the time it would take for that family to take their child and to be seen by the 10 of us in different locations at different times, and we would never interact across professions in coming up with this plan. So Sonia asked me to talk about this, and I really think that financial planning is in a unique situation because most wellness centers and craniofacial anomaly teams are teams that deal with traumatic brain injury or stroke or autism or Down syndrome. I can't think of any of them that have had financial planners that were part of that team. There are certainly social workers, which are very important to learn to help them get in touch with resources and things of that sort. But there's never been that I know of a financial planner. And if you think about it, everything I read, Sonia knows obviously way more about this than I do, but everything that I read, financial management, money management in the home is such a major issue or topic for just a traditional family. We're talking about someone where, they have a child and they've been diagnosed with autism. What does that do to the family dynamic from a financial standpoint? Or somebody's son has a traumatic brain injury, or somebody has had a stroke. And so the reason I'm excited about sharing this with you is that I think there are really outstanding opportunities for you as financial planners someday to get involved in this kind of team management, and it will really make a difference.
Absolutely. And I know we talked about this quite a lot when I was at K-State with you, Bob, that there's such a huge need to involve financial planners in some way to this circle. You touched on so many of these different professions. This is from your professional organization. I'm sure it's recognizable to you.
Yes.
But I think you also said a lot of words in that most people in this class have never heard of. Like even just the word audiologist, I'm not sure is a word that is commonplace for a lot of financial planners, unless they have some sort of family history in terms of engaging with an audiologist. And maybe we think about, oh, that's only for people who are hard of hearing. It's not the case at all. So I loved that you mentioned autism, and maybe I wonder if you could talk just a little bit more in terms of how a person would come to interact with an audiologist in particular.
Well, with audiology, unless someone is having significant hearing issues, and even if they were having hearing issues, most likely they would go, if it was a child, they would go see the pediatrician first. And if the pediatrician had experience, well, then they may make that referral to the audiologist, but they may not make that referral. If they go see an ear, nose, and throat doctor, well, absolutely, the ear, nose, and throat doctor will know about the audiologist. And so, what I would say to you is that, and that gets back to interprofessional practice, it's actually having not just this superficial understanding of what an audiologist is, or what a financial planner is, or a geneticist, or a speech pathologist, but it's actually having a working knowledge of all these other professions, so that you can come up with your when you come up with your findings, understand how other professionals are going to impact that. So let me give you an example as a financial planner. You're seeing somebody who has a bilateral sensorineural hearing loss, but you don't know anything about it, and you're trying to communicate with them, and your perception is that they're coming across like they're a little bit confused, and you're sitting there saying, well, gosh, I wonder if this patient is experiencing some kind of cognitive confusion, when in fact they have a bilateral sensorineural hearing loss that is causing them to not fully understand or to misunderstand what you're saying. You don't have to know everything about audiology, but if you have a basic understanding of the auditory system, you are going to take that into account when you're meeting with that family and that client, and the way that you present your recommendations. You might provide a lot more written than you would saying it orally, and things of that sort. So that's when we talk about interprofessional practice. We need to know about other professions and what they can do, what they can offer, and how their findings might impact what we do, and how our findings may impact what they do.
Absolutely. You know, I also talk a lot about personal biases in my classes, and how oftentimes we have no idea what our biases are, but they impact the way that we work with our clients. And I'm thinking about a child that you and I discussed now 3 years ago. I think it was when my middle child was in kindergarten. His best friend was a deaf student, and he wanted this boy to come to his birthday party. And so I asked his parents if this boy could come to Noah's birthday party, and they were all concerned about it because he was deaf. And I think this was his first outing. And I was like, it's no big deal, right? Like he has the cochlear implant. Is that the
Yeah,
right word?
cochlear implant.
And so he could hear us fine. But what I did not anticipate was not being able to understand his speech. He was 5, and he had not developed some of those language skills that we as hearing people had already developed. And so there was a communication barrier. So I think that was unexpected for me, but also just thinking about how children are so good about treating other humans as intelligent social humans. And the friendship, Noah's birthday is today, actually. And so this child is coming to his birthday party again this year. And it's just really amazing to me how children are able to differentiate differences in speech from intelligence or social interactions, and how many of us tend to yell at people when we see that they have a hearing aid. Not helpful
Right,
whatsoever.
right.
So just even just recognizing some of those biases that we're bringing into our work with clients, I think is informative. I have another picture for you, Bob.
Okay.
Okay, so I'm wondering if you could, this is completely your opinion, but I'm wondering if financial planners are more suited for the multidisciplinary team. Full disclosure, I haven't fully thought through this, or are they really part of an interprofessional team? So we see over on the left how it's really connecting with the other professionals, which is exactly what you were describing. Or do you see financial planners as maybe just being part of a multidisciplinary team?
I think they could be certainly in the multidisciplinary team, but my experience has been in an ideal world, they would be part of the interprofessional team because, again, if I think about most of the professionals that these families are dealing with, they're going to be dealing with fairly highly educated individuals who make a pretty good living. And unless this individual grew up, this professional grew up in a situation where they know what it's like to live check to check, or they know what it's like to have your credit cards maxed out, or they know what it's like to lose their job and now they're getting, money through Medicaid or something of that sort. I think that the financial planner can really help educate these other professionals on what this family is dealing with and what are strategies that that family can take to deal with this major bump in the road that maybe they never anticipated. So,
Mm,
yeah, so I think that absolutely if they could be involved that way, because again, I can't imagine, and you and I've talked about that before on money and things of that sort. I can't imagine when you're faced with a healthcare challenge that money is not going to be an issue in how you manage your finances for probably 90 to 95% of the people that are dealing with that. I don't know if
mm,
that's a fair statement, but
yeah, yeah, definitely.
so yeah, so I think that they are so important not only for the family, but I really think for the other professionals because it's easy. I can remember being on that team and saying, well, they need, everyone's talking, the professionals, well, they need to go do this and they need to do that and they need to do this. Well, all of these things require travel, money, resources, and there was no one there saying, well, you know what, this family resource wise, this would be a real issue because if we would have known that, then maybe as a team, we would have changed our approach and changed our comprehensive care plan as a result of having that information.
Hmm.
So,
Yeah, we have spent so much time talking about this, and I am very thankful that you allocated some time to talk with my students about it too, because it's hard to wrap your mind around this idea unless you come from a profession like yours to where this is more common. And really trying to get this going within the department that we were both affiliated with, you still are, in terms of how do you make this work just across those two disciplines. And it's hard because somebody has to take the first step and be the person to be like, hey, I want to create this interdisciplinary team. And we're all busy and stressed for time, but the client outcomes are going to be so much more successful if one person, the financial planner, is willing to reach out and start these teams. Would you
yeah.
agree?
Oh, absolutely. And again, I always like to say that all of us that work with people, our ultimate goal is we're trying to improve the human condition from many different angles. And I've seen it in action where having people together like that, when you come up with a comprehensive plan and you're sharing this information back and forth, and that's what IPP is all about. And I'm learning more about what you do. And again, not just some brief definition, but I get to the point where I understand, how do you evaluate their family situation financially? What are key things that you're looking for? What are common recommendations that you have? It's not that I'm going to ever do financial planning or I'm ever going to be a dietitian, but when I have that kind of understanding, I'm in a much better place to think about my recommendations and how they impact or how they're influenced by other professions. And again, the person that ultimately wins is the client and the family.
Absolutely. Thank you, Bob.
Okay, thank you.
Appreciate it.
All right.